Welcome to the Haven Hubcast, a place to learn what business leaders, owners, and professionals are doing to navigate and grow in today's market. Hear from industry experts on everything from marketing, leadership, financing, and more. Brought to you by Haven, a co-working space where you can connect, create, and get stuff done.
Hello, and welcome to another episode of the Haven Hubcast. I am your co-host, Nancy Sheed, and I am very excited to be here with Katherine Saunders. Katherine is an obesity medicine physician at Weill Cornell Medicine. She specializes in the care of patients with obesity and weight-related medical complications. She is also the co-founder of Intellihealth, which is a healthcare technology company whose mission is to scale and democratize access to effective obesity treatment. Katherine, welcome. We are so excited to learn more about your business and your journey to get there. Thank you for being here today.
Thank you for having me, Nancy. I'm very excited to be here.
We got to chat a little bit before we hit the record button. And I was telling you, like, the first time I met you or learned of you and in telehealth was at a Haven Hatch presentation. So I look forward to diving in and hearing more about that and your business journey. But first, would you mind sharing with our listeners, how you go from medical school and becoming a doctor to your specialty to now being a founder of a business that has a very specific focus?
Sure. Happy to give my background. I did my medical training at Weill Cornell. I did my residency in internal medicine. And during my residency, I found myself treating my patients for so many different weight-related complications. And during my medical training, I really had next to no education on what obesity is and how to treat it effectively, and very minimal education on nutrition. So I was very frustrated that I was treating my patients with so many different medications for a variety of weight-related complications like diabetes, heart disease, arthritis, fatty liver disease, so many. There are actually over 200 weight-related medical complications.
Wow.
And so during my residency, I decided to subspecialize in this new field of medicine really called obesity medicine. And the director of our comprehensive weight control center at Weill Cornell is Dr. Louis Aroney, who is one of the pioneers of the field. He's been practicing for 30 years, and he really is one of the physicians who developed the field and was part of many of the clinical trials to develop what we call anti-obesity medications. And so I was fortunate to be able to be the first fellow at Cornell in obesity medicine. And I spent a year at the practice learning everything about what obesity is, how we treat it effectively, why it's not just a lifestyle problem, and it's actually a disease that requires more than just calories in, calories out, eat less, exercise more. I learned how to talk to patients about their weight in a really empathetic way, and learned every single medication, every single surgery, everything we have in our arsenal of how to help patients actually lose a sustainable amount of weight. And so that was a wonderful experience. I then decided to join the faculty practice there. And then a few years into my practice, I decided to team up with Dr. Aroney to take what he had as a business he had started over a decade before, which was a technology company called BMIQ, which was designed to do what we're doing now. It was just the older version of it to really scale and democratize access to the kind of medicine that we do at Weill Cornell. And so we took the content from the old company and brought it into our new company called Intellihealth, and really built it out so that we have everything that would help a provider who doesn't have a strong background in obesity medicine to get up to speed in, again, kind of what obesity is, how to treat it, how to talk to patients about it, how to set up a practice that incorporates obesity medicine, how to do the billing, how to do the documentation. So that's on the provider side. And then on the patient side, we kind of describe it as a, a program like a Noom or any other kind of weight loss program, but that is a medical version of that. So it's intended for patients or people who are seeing obesity medicine specialists and may be on medications for their weight, which I'm happy to talk about more why we do that. And it really allows them to have access to all of the educational information they need, tracking abilities, and so forth. And so that's been the progression from internal medicine to obesity medicine to starting this company to really spread what we do, since there's such a supply-demand mismatch here.
You started talking about the providers, and I'm like, I know there's a patient part of this. And I love the support to the providers, that it's a two-pronged approach. Before sort of diving more into the sort of your business, yours is not a typical path, right? Doctors don't always go, going into education and academia is a route, but going into, co-founding a business is not always a straightforward path. How did you make that decision? Or I know you mentioned that the work was already there, but it sounded like it needed to be next level. Was that a hard decision, or how did you come about in making that, sort of adding that to your LinkedIn profile?
Absolutely. So as soon as I started my training with Dr. Roney, I was very interested in the technology that he had developed, because I recognized that there was such a huge need to address the fact that 74% of the country has overweight or obesity. And I'm literally one of fewer than 75 fellowship-trained obesity medicine specialists. And so I, off the bat, started signing up every single one of my patients for this online program. We actually did a research study looking at my data, and we published that, showing that patients who were using the program did better than patients who were not using the program. And then it was actually my husband, who has an entrepreneurial background, who realized that this tremendous opportunity and wanted to do something like this. So the two of us actually teamed up with Dr. Roney to develop Intellihealth. And so now we work together, which has actually been working out very well. So many people say to us, oh my gosh, I could never work with my husband. How do you do this? But he's on the finance side and I'm on the medical side of the company. So we come together for some meetings, but we really have very, very separate roles.
Fantastic. Well, it probably made it, I don't want to say less intimidating, but having an enthusiastic entrepreneurial spirit along, I think always helps and makes it feel a little bit less daunting, especially if that's not your proclivity to think that way, as it were. I just wrote these statistics in terms of the disparity of 75% of the population and only 75 people that, we know anecdotally that obesity and overweight is a problem in our country, but holy moly. And I think was my impression when you were doing your presentation was we thought we knew what we knew, but it sounds like on a boots on the ground sort of what's going on in medical offices. It's not being treated or handled or acknowledged in the way we might assume or think it is.
You're right. Well,
thank you for taking that charge. And what's in terms of launching your business or in terms of founding this business, how are you growing? How has it been from going from business conception to either launch or beta launch or founders? I know, all of these things have played into that. What does that look like from your perspective?
It's going very well. We've been very fortunate that there is such a focus on obesity now. So, the timing with COVID was interesting in that it was helpful in some ways and not helpful in other ways. But, founding our company about a year before the pandemic, it's been hard to sell into hospital systems that are dealing with COVID, and that's clearly their priority, and they're not thinking about obesity as much. But on the other hand, two things that have come out of the pandemic that have been very helpful for us, and talking about trends in our field, obesity, there's been so much more of a focus on obesity, just in that people who have obesity experience, more severe COVID and more severe ramifications from COVID. So the focus on treating obesity and really having that be a priority has been great for us, because we're really well poised and ready to deploy in many different ways. And also the idea of telemedicine. So as soon as the pandemic hit, our practice went from 100% in person to 100% virtual. And it's worked out great in our field of medicine. We can do basically everything we need to do virtually. So I haven't seen a patient in person for almost a year and a half. And
Wow.
our patient volume is higher than it's ever been. And I definitely have some patients who are dying to come back and have in-person visits, but I would say the majority find it to be very, very, very convenient to be able to only block off 20 minutes instead of having to take half a day of off work and drive in to have an appointment and wait. And, it's just totally different. And so while medical practices have certainly opened up quite a bit, telehealth is really here to stay in some capacity. So that's very exciting in that we're able to treat more people, especially people who are in remote areas and different groups that we weren't able to get to before.
And I would think taking that a step further, that has only served the actual growth or direction of your business in terms of being a technology company, right? Like it doesn't seem as weird that you would be getting medical advice or medical support, right, through a technology company, because I noticed that you lead with that. So my hope is, in addition to just treating the patients, that we've all gotten more used to this is the way we're going to get this information. So that as a platform, I hope has served Intellihealth well.
Yes, exactly. I mean, the unfortunate truth about our situations now is that most of us are, sitting at our computer in front of Zoom all the time. And, while that was not a reality at all before the pandemic, people are much more comfortable, living in their computers and having access to many different things that were in person virtually.
Fantastic. Before we get on to sort of, I keep going back and forth between who you help and how you help, as well as wanting to inquire about your journey. For people for whom obesity is a challenge or a part of their lives, if they aren't, you mentioned the now over 200 medicines. Did I write that down right? In terms of, weight-related conditions, sorry, is there is there an assessment or are there steps that you give advice? Is it a matter of a consultation? How do you help people sort of figure out what their first best steps are if that doesn't put you entirely on the spot?
Mm-hmm. No, that's a wonderful question, because I think a lot of people even end up having an initial visit with us, not really understanding who we are and what we do. And, another statistic that's really mind-blowing is that out of the whole population in this country with overweight and obesity, only 2% of that population is actually being treated according to guidelines. So that's really terrible when you compare it to diabetes, where it's 86% of people with diabetes are being treated according to guidelines. So basically what we do is we do a very, very, very comprehensive evaluation. Our typical patient is someone who has tried many different lifestyle approaches, tried many different diets or programs, and maybe they were successful and could lose weight a handful of times, but always regained the weight and kind of got to a point where they were really frustrated and realized that they needed more than just another diet. And most of our patients come to us either referred by their physician, or they have friends or family members who have seen us and done very well, and they asked what they had done. And we have a lot of personal referrals, which is nice. And what we do is we really do a very, very, very comprehensive history, and we do a comprehensive look at labs, and we try to, pick out from all that information, what are the factors that are leading to this person's weight gain? And what are the barriers that are preventing weight loss? And again, it's so much more than just what someone is eating and how much they're exercising. There's so many different factors that can push weight up and prevent weight loss. And so we screen everybody for sleep apnea. It's really underdiagnosed and really related to weight. And that's a huge thing that we identify. We also look at patients' medication lists. There's many different medications out there that make it easier to gain weight and harder to lose weight. And by identifying those and changing them if possible, that can be a very big intervention. other lifestyle factors. Some people eat very late into the evening. Some people eat in the middle of the night. Some people work all night, so they're eating all night. These are all factors that cause people to hold on to calories and make it very difficult to lose. So we look at all of these different pieces and come up with very comprehensive plans where we figure out the most sustainable way of eating, where someone doesn't feel like they're on a diet and can just eat in a way that works and a way that's sustainable, some kind of exercise that makes sense, and then adjusting medications if they're on anything weight gaining. And then finally, if all of that is optimized and that's not sufficient, that's when we would use what we call anti-obesity medications. And we do have 6 that are FDA approved for weight. And we have a handful of others that are related to those that we're able to use. And a lot of people find this idea of using medications for weight to be, something they've never heard of before and something very surprising. But when you think about obesity being a disease, just like high blood pressure, diabetes, high cholesterol, if lifestyle modifications are not cutting it, the recommendation according to guidelines is to think about medication.
I love the holistic approach, right? Like it's not just the quick fix, right? And I love the comprehensiveness of how you've described this process and honoring that it's no longer, what you're eating or how you're exercising to do that. How do you, Katherine, as a doctor and a founder, what does your day-to-day life now look like in terms of treating patients versus being the founder of a company that needs your input? What does that look like for you present day, kind of post-COVID?
That's an interesting question, and it definitely depends on the day. I used to be full-time seeing patients several years ago, but I'm currently part-time. I see patients 2 days a week, and then I spend the rest of my workday hours working on the company. I also have 3 children under the age of 3.5, so I feel like I have 3 jobs.
At least 3.
So, every day is a little bit different, but it's some sort of attempt at a balance among those competing responsibilities.
Got it. Well, I know those of us who balance a lot, or at least integrate is another word. It's not always feeling like a balance, but integrating all of these moving parts, right? Let's go back to Haven. As I said, the Haven Hatch is there. We like to call it the friendly pitch contest. That's where I first learned about you and Intellihealth. How did that come on your radar screen, and what was your experience like in terms of, talking about your company and pitching it to a new audience, as it were? And what has that led to?
It's been such a wonderful experience. So because of the pandemic, actually, my husband and I decided to move from New York City to New Canaan, Connecticut. And I actually read the local newspaper every morning. I love getting it in my inbox and seeing what's going on. So I had seen an advertisement for Haven Hatch, and I thought that it sounded very interesting. So I decided to apply. I was very fortunate to be the winner of Haven Hatch back in April. And
Woohoo!
I have to say, thank you. It was a great experience. It was one of my first pitches, and it was just such a supportive group of women and ended up leading to so many great opportunities. So after winning Haven Hatch, several of the listeners or the viewers we met with and ended up investing in the company, which was exciting and a wonderful opportunity. And just being part of this community of very interesting and successful women is such an honor. There's such a need among women, especially, small business owners, founders, to have a support system, because it's hard. Starting a company, there's so many ups and downs, and some days are amazing and so many good things happen. And then other days can be extremely disappointing. And, many of us women have families and have other responsibilities. So this is all very, very challenging. And, having that support system and having, opportunities that are focused on women is really hard to find sometimes. I'm actually part of a female founders group as part of Weill Cornell's BioVenture eLab, and we meet once a month. We had a session last night where many of the founders were talking about how it's much harder to raise money as a woman, and there's so many other challenges. And so, having been part of the Haven Hatch pitch and, being introduced to this incredible group of women was sort of the beginning for me. And then after that, I really started to look for more women-focused investor groups, women-focused competitions. And there's a lot out there, which is great. So I really am so grateful to Haven for being one of the first experiences for me.
I love that story. And I love that you found them in an ad. I want to, as a marketing person, I love to hear how people heard of things. So that's wonderful. And it sounds like it sort of set the tone for you of they are out there, they can be found, and they're, of benefit versus the toiling away on your own and feeling as though nobody understands you or knows what you're going through. Or also, I think just the network in a good way in terms of if you have a question or, you're looking for something, you're looking for help. I think that's the other piece that I love that the Haven community, brings. Well, and welcome to Connecticut from the city. Welcome. I'm sure that was an adjustment as itself. Katherine, tell us, for people who are interested in connecting with you or learning more about your company from either in and of its business or investing or learning more about where you are in your startup journey or wanting to learn more about how to actually take advantage of and use the services, what are the best ways to reach you and connect with you?
Sure. I'm happy to connect with anybody who is interested. I'm really so passionate about what we do. So if there are any listeners who are not close by and don't have access to, seeing one of our providers at Cornell or, a specialist in New York or Connecticut, I'm always happy to be a resource and connect whoever it is to good obesity medicine specialists anywhere in the country. It's really a network of researchers and clinicians who are all very passionate about what we do. And so, yes, I practice at Cornell. In terms of the company, right now we're really working with different academic institutions. So we're at Mass General, Brigham and Women's, Geisinger. We're with Hospital Corporation of America and a handful of others. We're not direct to consumer, but we are starting up our own affiliated clinical services line. So that is in the works and will be available soon so that we will be, providers providing care directly using our software and using, everything that we've developed with the company. So in the near future, that will be available. But in the meantime, the providers are all through, academic institutions like Cornell. To find more information, I'm on LinkedIn and we have a website. It's intellihealth.co.co. The Evolve website, Evolve is the name of our software platform. I believe it's evolveme.health for more information. And if people want to reach out, I'm always happy to, help people clinically or talk about, investing or collaborating. Whatever it is, I'm very reachable and always happy to talk.
Thank you for making yourself so available, both for this podcast, but that is a huge gift just to make yourself available, as you said, for people who don't know where to start or don't feel like they have the access. So that's a gift and very generous of you. And we will watch this space to see where Intellihealth goes in the direct-to-consumer space. It's going to be very exciting. Thank you again, Katherine, for your time. It's been a pleasure. I have loved learning about this and meeting you and even learning more about and being more impressed with you and your journey in the Intellihealth organization.
Well, thank you, Nancy, for having me. It's really been an honor to be with you and chat with you. And I'm just so appreciative of the opportunities through Haven. So thank you to Haven.
And on that note, thank you for listening to another Haven Hubcast. We will be back next week. And if you're not already subscribing, please do.
Thanks for listening to the Haven Hubcast, a place to learn what business leaders and owners are doing to navigate and grow in today's market. Please leave a review on Apple Podcasts and subscribe on your favorite podcast app. Haven is a co-working space and virtual community located in the heart of Fairfield County, Connecticut. Haven is a hub for business owners and professionals to connect, create, and get stuff done. Find out more about the Haven community online at haven.com That's HAYVN.com. Haven Hubcast is produced by Sound Advice Strategies.